I'm delighted to be able to tell you about some exciting new services that we have developed across Leicestershire. By listening to you, your families and carers, we know that you want a more joined up system of care. As a practicing doctor, I know that we rely on the hospital too much. You know, the hospital is not the answer. So what we're doing with these new services is to give you support 24/7 in the community. So for example, if a frail older person has a fall or they have a crisis, they're looked after in their own home. We know that that requires a joined up approach between health and care, and this new program is designed to do exactly that.
Hello, I'm Emma. I used to be fit and well, but as I get older, my health isn't quite so good. I sometimes struggle with life at home by myself. I used to be able to go out and about and regularly meet my friends in town, but I started to struggle around the house and couldn't do the things I always used to do. I didn't always have food I fancied, and so sometimes I didn't eat. Then one Sunday morning, I had a fall. My neighbour found me and called an ambulance. There were no services available that could help me at the weekend, so I had to be taken to hospital. I didn't want to go to hospital, but the paramedics wanted me to be checked over and didn't want me to be at home by myself. I had to stay in hospital for weeks. There were lots of different people involved in looking after me, and it got really complicated. I became more dependent on support and less able to do things for myself. So when I went home, I found it hard to cope. I ended up going into a care home. I didn't know anyone there and was only able to bring a few of my own belongings with me. It would have been nice to be able to stay at home in the surroundings I know. I think I would have got better if I could have stayed at home.
But did Emma need to end up in a care home? Across Leicestershire, we're working to join up health and social care to help people like Emma. Our new care schemes would have helped her get the care she needed in her own home and avoid her going into a hospital or a care home. So what will these new services mean for people like Emma? We've introduced 3 new schemes to reduce emergency admissions to hospitals or care homes. The Fall Service. If Emma had a fall and a 999 call was made, an ambulance would go to her house. If it wasn't a medical emergency, the paramedics would give priority to treating her there, rather than taking her to hospital. If the paramedic identifies a reason for her fall is due to health or housing problems, then the second of our new schemes will be introduced. The Integrated Crisis Response Service. If Emma's fall didn't require emergency treatment, but was due to persistent health or care problems, the Integrated Response Team would be notified immediately. The team of nursing, therapy and social care staff would go to Emma's home to provide preventative care and equipment she needs to stay at home. They provide support day and night for up to 72 hours. The Older Persons Assessment Unit at Loughborough Community Hospital. If Emma's GP was concerned that her health was getting worse, she could be referred to the Older Persons Unit at Loughborough Community Hospital for further investigation. Transport would be provided to get her to the hospital and back home. Emma would be assessed by a team of doctors, nurses, therapists and social workers, all within 3 hours. Following the assessment, Emma would be driven back home. Then her care plan would be updated and handed back over to her GP and care team for ongoing support. These new schemes join up NHS and Leicestershire County Council services. They're part of the Better Care Fund, which has a total budget of £38 million to provide more integrated care in the community. These services will be particularly for frail older people like Emma, those with long-term conditions and other vulnerable groups. In 2015, we aim to reduce emergency admissions by 2,041. This supports Better Care Together, a 5-year plan to join up health and social care across Leicester, Leicestershire and Rutland. It brings together NHS, local authority and patient voice partners to make sure that the needs of people are met throughout their lives. For more information, follow us at LEICS HWB.